Friends of media, good morning. Welcome to this morning's 11 o'clock press briefing. We have the Chief Executive and the Secretary for Food and Health and the Chief Executive of the Hospital Authority with us. The Chief Executive will be saying a few words first. Because of COVID, please keep social distance and keep your mask on. Chief Executive. Friends of media, fellow citizens, good morning. As you probably remember, on the 9th of March, I've started this daily press briefing, except for Tuesday. At the first press briefing, I introduced the anti-epidemic efforts and also the focus that we put on treatment, and that was with reference to the advice given to us by the mainland medical teams. The focus of treatment is basically three reductions: reduced death, critical cases, and infection. Now, given the fifth wave of the pandemic and Hong Kong's aging population, a lot of people are living in the elderly homes. We've seen a lot of fatalities among the elderly population, and we've seen infection and outbreaks in a lot of the care homes for the elderly. Since then, on March the 14th, 17th, 24th, together with the SFH and the CE of HA, we brought the public up to date on the treatment work in Hong Kong. It's been 10 days since March 24th, so today I'll be focusing on the treatment aspect of the anti-pandemic efforts. Today we are going to be introducing the combination of treatment involving the Western and Chinese medicine. On March the 29th, we welcome the fourth medical team of 7 members from the mainland to Hong Kong. They are the TCM experts from the mainland with a whole wealth of experience in tackling the pandemic. They have a lot of experience in treating the COVID patients. The team was led by Mr. Dong Xiaolin. And if you read the news, the press release, the TCM team has been going around the hospitals, visiting the patients and talking with our colleagues and share with them their expertise. We agree with the advice that is offered by the team. The SFH will be bringing you up to date in a moment. Now, we have the combination of Chinese and Western medicine, and also for Western medicine, we have procured enough stock of the antiviral pills for COVID, and Dr. Tony Ko will be bringing you up to date on this. Now, in terms of priority, we have to prioritize the senior citizens in Hong Kong. So in terms of vaccination and COVID testing, we urge the senior citizens and their family members to come forward more proactively. Yesterday, for those above the age of 70, we've announced a measure to allow them to turn up at the testing centers or the mobile stations to undergo PCR tests in order to identify the infected cases, in particular those who were asymptomatic or those with very mild symptoms. We urge the senior citizens, like the rest of the population, on May 8th, 9th, and 10th to undergo RAT testing in order to minimize any fatalities or any severe cases. The best way forward is to get the jab. So we urge the senior citizens again to go get the jab. Of course, we will be resorting to various means to help them get inoculated, but at the end of the day, we have to have the cooperation of the senior citizens and the family members in terms of vaccination or the PCR test or indeed the RAT test. I defer to Professor Sophia Chen, Secretary for Food and Health, to brief you on the use of TCM. Thanks very much, Chief Executive, friends of the media, fellow citizens. Chinese medicine has been playing a very important role in the prevention and treatment of COVID. On March 29th, the mainland TCM team, led by Mr. Tong Xiaolin, came to Hong Kong to conduct a visit and render support to our anti-pandemic work. The TCM team has a packed schedule over the past couple of days. They've been meeting with the FHB, the DH, and the HA to find out what the latest regarding COVID. They've also tried to understand our work and the progress of our efforts, and also how we can include TCM in our treatment. Of course, they've also met with the Chinese Medicine Authority and the chairman of the authority to understand about the regulation of TCM in Hong Kong and how can TCM can be used in our battle. There were some discussions there. Other than the meetings and discussions, they've also visited a lot of our facilities, like the QE Hospital, the North Lantau Hospital Infection Control Center, the Hong Shui Kiu Community Isolation Center, the Kwun Chong Choi Wing Road Holding Center. They've also been to some of the elderly centers and TCM center run by the Hong Kong U and the Parkway Hospital. They've also tried to understand how TCM is used for the treatment of COVID patients. They've also tried to understand the recovery of patients. This morning, they're continuing with their hectic pace, and they are continuing with their visits. They are liaising with the TCM practitioners and other relevant people. And through these visits and meetings, the expert team will get more understanding of our anti-pandemic work and how the government, the hospital authority, and the private sector are using the TCM in the battle against COVID. They are offering a lot of advice to us in order to heighten our prevention ability in our battle against the pandemic. Now, Mr. Tong Xiaolin gave an interview yesterday, and he put forward the 3 easies approach, and that is easy to use, easy to implement, and easy to access approach. And in fact, the Bureau has been supporting the use of TCM in prevention and treatment. We are shouldering an important role there in the entire healthcare system. We are moving ahead with the use of Chinese medicine. In January this year, the hospital authority has rolled out a TCM treatment service, mainly at the North Lantau Infection Control Center and AWE Community Treatment Facility, and they are using TCM in the treatment of the COVID patients. And this is really a combination of the use of Chinese and Western medicine, and Chinese medicine playing a very important role. At the AWE Community Treatment Facility, as the mainland medical team has started their work, the process has already been improved. All the patients admitted to the center will be examined by a combination of Chinese and Western teams. And for those who are willing to accept Chinese or TCM treatment, they will be given TCM treatment. And the Chinese and Western teams will be making their rounds together, and they will be jointly discussing the treatment modality, and they've been cooperating hand in glove. We are really truly grateful to the mainland medical team for the support that they rendered, not least at the AWE CTF Center. The scale of the TCM service has been scaled up. We are providing 300 patients, about 1,000 or so attendances. And at the CIFs, they will be given the anti-pandemic packs with the proprietary Chinese medicine. And the HA has also designated a hotline for TCM, and registered TCM practitioners will be addressing questions. We have dealt with 6,400 inquiries so far. Now, for those who are infected, by the time they are discharged from the facilities, all the 18 TCM clinics are providing TCM consultations. So within 6 months after discharge, they will be entitled to 10 consultations with the TCM clinics for them to put them on the path of recovery. At the holding centers, at the Kai Tak Cruise Terminal Holding Center, we have already started a phased operation. We are taking over the mild cases from the hospital authority, and also from the homes. After diagnosis, if they have to be isolated, they will be sent to the holding centers. Now, at the holding centers, we have the 2 universities, the Baptist University TCM college, and they have a team there to assist the elderly patients. And also the Kwun Tong Choi Wing Road Sports Hall Holding Center. The TMHK is offering TCM service to the elderly people. Now, for the care homes, we have mobilized the TCM services, and the TCM consultation service offered by the HA will be offered for the telemedication or medicine. Of course, through the TCM Development Fund, we have a $500 million fund whereby a certain amount has been set aside for a support scheme to be launched for the TCM practitioners to offer telemedicine for free, and also for the distribution of Chinese medication. And all of these involve the patients at home. This is jointly organized by the TCM practitioners. On the 22nd of March, we've already started the registration. The response has been really overwhelming. We have 20,000 patients who stand to benefit. Finally, we're truly grateful to the central authorities for donating the proprietary Chinese medicine, the 氧化气温胶囊、金花氢感颗粒 and 藿香蒸汽片. As of now, we have distributed 9.3 million packs as part of the anti-pandemic service packs. There are other batches that are being arranged at the moment. And the TCM, or the proprietary Chinese medicine, will be made available to the isolatees or the quarantinees, and will make available the proprietary Chinese medicines to them at the CIFs and also at the TCM clinics, teaching centers. We will be making available all these proprietary Chinese medicines to these people, so that they will make full use of the Chinese proprietary medication. And the TCM practitioners are tying in with the anti-pandemic efforts, and they are taking part in the treatment and of the patients. Together with the TCM practitioners, we will be coming together and make the most of the Chinese medicine. Now, with Mr. Tong and his team, we are having a lot of good advice so that we can develop the potential of TCM in our battle against COVID. At the end of the day, we try to protect every single one of the community.
We will hear from Dr. Tony Cole from the Hospital Authority. Thank you, Chief Executive. Good morning, everyone. As infections are gradually falling, the pressure is clearly easing off on our services. Based on the data from yesterday, in those currently in the hospital system, there are roughly 9,000 people who have been infected with COVID currently receiving treatment in hospitals. Further analysis and the data suggests that many such cases have already tested negative, but due to some other underlying chronic illnesses, they're still receiving treatment. For those who still test positive, there are roughly 5,000 cases who still test positive. Some people tested positive upon admission and then they tested negative. So then that gives our hospital beds more flexibility. We still have many patients in the hospitals, but there's a significant reduction in the pressure on hospital beds. Another reason is the Asia World Expo treatment isolation facility. We have the assistance from the mainland medical team. Our capacity used to be 200 patients or so, but now we can, as of yesterday, we could care for around 400 patients. So now our capacity has been boosted in terms of treatment for patients. As the Secretary just said, we're also adopting integrated approach of Chinese and Western medicine, and also in terms of nursing and clinical care. Service has seen much improvement. At the Asia World Expo COVID treatment facility, we're caring for the elderly who need personal care. Now we have an additional 300 to 400 medical workers helping us out, so there has been improvement in the quality of care we provide. We mentioned the 3 reductions just then. So now there is a reduction in infections and there is a reduction in the need for hospital services. There is also a significant decrease in severe cases. Here's a number here. At the peak in early or mid-March, in the hospital, we had roughly 250 patients who required an oxygen and ventilator. Now the figure has dropped to roughly 150 such patients. So that's a sharp reduction. And in terms of death cases, at a peak, as you could recall, every day there could be 200 to 300 deaths recorded every day, but recently the figure has dropped to a lower level, roughly 100 deaths per day. That's still a high level, but we hope the downward trend can continue. In terms of infection, severe cases and deaths, there's an obvious decline. And in terms of demand on our services, when we had many infections, people couldn't be admitted immediately, even when they came to the A&E departments. And for those who have been diagnosed with COVID, we can now handle such patients and arrange hospitalization for them. Apart from hospital admission inpatient services, at the outpatient clinics, we have also activated 23 designated COVID clinics. And we could cope with the need for the services. In terms of the figures, as of yesterday, roughly 1,600 people use the services. We have 4,000 slots available each day, so the usage rate was roughly 45%. As for seniors and those at a higher risk, we prioritize care for the elderly, so we have special tickets for the elderly, and the usage of such special tickets stood at around 400 such tickets per day. We set aside more than half of the slots for the elderly. So roughly 2,000 tickets have been set aside for them, and they're just using roughly 400 or so. At our designated clinics, to boost our capacity at such clinics, we have been able to meet the service demand. And for the seniors and others who are not familiar with making an appointment over the phone or on the internet, they can also do walk-in, and our staff will help them out and arrange treatment for them. A key area here, the treatment, is that we will administer antiviral drugs when in necessary cases. And for the seniors and other high-risk groups, we also have a hotline available for them. There are 180 lines for the hotline, but the demand for service has dropped. At the peak, we received roughly 3,000 calls per day, but recently the number has come down to roughly 800 calls per day. Those who need help can give us a call at this hotline and receive help from our team. In suitable cases, our staff recommend that people come to our designated clinics for treatment by getting the drugs. And if the patient's willing, we will also arrange a slot for the patient to receive treatment. As fewer people get infected, fewer people call the hotline, but our staff also proactively call patients. Say you have a patient who tests positive after a PCR test, and we have this data, so our staff will be aware that someone has tested positive, and with the phone number for cases involving seniors aged 70 or above, our staff make a proactive outbound call and find out how they're doing and may recommend them to receive treatment at designated clinics. Now we're making 1,000 or so calls per day, but with fewer cases, we may reach out to other people as well. We also have the patient call support system. So we will be, when we have, say, thousands of cases per day, we sort out the high-risk cases, say those aged 70 or above, or children age 5 or below. We make those proactive outbound calls to support those who need our support. In terms of treatment with drugs, we now have 2 effective antiviral COVID drugs. We have been proactive in encouraging people, in cases where appropriate, to receive such treatment based on data as of yesterday for the 2 COVID drugs. For the one from the Merck and the drug from Pfizer, in total, we have administered more than 23,000 courses of these 2 drugs to people every day. Most of the drugs are administered at the designated clinics. That's expected because most of these people presented with mild symptoms, so they went to the clinics. As for our outreach team, once they become aware of infections at elderly care homes or care homes for disabled, to provide assessment and administer drugs. And the drugs are also administered in hospitals for inpatients in suitable cases. This is also done in A&E departments, isolation facilities, and isolation hotels. As the Food and Health Bureau announced yesterday, private doctors, and if they have such a need, the FHB will arrange for the COVID drugs to be delivered to them. We are aware that for some private hospitals, they may come into contact with COVID patients, and the patients are receiving treatment there. We arrange for some of the stock of the COVID drugs to be available there so that the drugs can be readily available for the patients. A reminder to the public here. People have some misconception about the drugs. We may reach out to people over the phone. Say there's a senior over the age of 60. We recommend treatment for the elderly by encouraging them to get the elderly to our clinic. But some people believe the elderly member has only mild symptoms, so there's no need to go to a clinic. This is not the right approach. For someone who is confirmed with COVID, and within 5 days of onset, in such suitable cases, treatment will be helpful here. In our clinical guidelines, for someone aged over 60, doesn't matter whether this person is fully vaccinated or not, we recommend this person to visit a designated clinic or other medical institution to receive treatment with the antiviral drugs. And even for those under the age of 60, if they have not completed their vaccination course, but they have other high-risk factors, say they have underlying illnesses or they are immunocompromised, we also recommend treatment in hospitals and designated clinics. we have enough capacity to meet the service need. We encourage and appeal to the public that if they have tested positive and it's within 5 days of onset, we recommend that they seek medical assistance and receive the relevant treatment. And don't wait till the illness gets worse and becomes severe, and then you go to a doctor. We also have a hotline. If people have inquiries, they can call the hotline. Our staff to offer help. When they sign up for a PCR test, or they're reporting the results of a PCR test or an RAT test, look out for the phone numbers. They input, because sometimes our staff couldn't reach the people with the phone. People input on the declaration platform. So these are the things I would like to report. Thank you. The floor is now open to questions. If you would to put a question, please put up your hand. Once it's your turn, tell us your media organization before putting your questions and use our microphone.
A lady in white in the middle, please.
MP. So I would like to ask, some residents living in subdivided flats has said that they can only receive one anti-COVID pack yesterday. And how can the operation be improved given in these circumstances? And also, would you please elaborate on the necessity to waive CE hopefuls from abiding with the social distancing rules? Is this needed when so many meetings could be conducted via video conferencing? And lastly, we would like to ask, how would the authorities make sure that people know whether they are suitable to take those traditional Chinese medicine pills in the free packages, given that the experts have advised a wider use of Chinese medicine for patients recovering at home? Thank you.
Well, thank you for the three questions. First of all, we started distributing the anti-epidemic service bags yesterday. And out of the estimated 3.5 million bags, I was told that we have distributed almost 1.3 million bags, despite the original target is to have all these distributed within a period of 7 days. Of course, we are distributing them on a household basis, but my colleagues and myself, we are very liberal when we delivered a bag, especially to the grassroots families living in buildings where there isn't any building management. And we always ask how many family members in your household. If we were told that they have 4 or 5, then we will give them an extra bag. That's exactly what I did yesterday at Sai Ying Pun. There were at least 2 or 3 families with a household size of 4 or 5. So we immediately provided a second bag to the family. So for those families, whether they are living in subdivided units or in other living conditions, if they want to have an extra bag because of the size of the family or because of other reasons, they could always go to the 90 service stations we are going to set up, I think, on the 6th of April, serving 2 purposes. One is for those whom we could not reach when we visited them during door knocking. So we will normally leave behind either a letter or a card with the information for them to collect the service bag from these centers. Secondly is, as we want everyone to do the RAT, the rapid antigen test, on a daily basis from the 8th to the 10th of April, and if somehow they have used up their RAT kits, which we have provided in the bag, then they are also welcome to go to one of these centers to pick up some extra rapid antigen test kits. Ultimately, we want everybody to be well provided and resourced in this situation. So the government will consider all means to make available the packs or the RAT kits to those residents in need. Now, about the CE election, Today is the beginning of the nomination period. At the press conference yesterday, I was asked by a reporter that if a prospective CE candidate who wants to get sufficient nominations from the election committee, and the threshold is quite high, the candidate has to receive 188 nominations from the group of 1,460-something EC members. Then the candidate will have to approach the EC members and explain his manifesto and maybe make connections and so on. So under the current very stringent social distancing measures, particularly these two ones, one is the group gathering limitation to a group of 2 persons. The other is really a very stringent measure we introduced in February, and that is prohibiting cross-family gatherings. So you could imagine if a prospective candidate has to reach maybe 5 or 6 or 7 EC members, they will be coming from different families. So it would not be possible for the prospective candidate to do that sort of appeal or in participation in gatherings to talk about his vision and so on. So I said yesterday that we will find a way, and actually we found a way, and the way is provided by the legislation. There's always an exemption mechanism in the relevant regulations made under the Prevention and Control Disease Ordinance, that is Chapter 599 of the Laws of Hong Kong. The power has been delegated to the Chief Secretary for Administration. So yesterday, the Chief Secretary for Administration, having considered the nature of this CE election activities, as well as the importance of the CE election, and it is in the overall interest of Hong Kong to make those exemptions from the 2 regulations that I have just mentioned. So I hope people will realize that this is a very important occasion for Hong Kong, and we would like to see the prospective candidates having this opportunity to seek sufficient nominations during the nomination period, and thereafter, for those who have been validated as a CE candidate to participate in all sorts of electioneering activities. So the exemptions granted by the CAS, the Chief Secretary for Administration, were very well justified. Now, as far as the use of Chinese medicine, the Secretary for Food and Health have given you a full account. It is not entirely something new. Many Hong Kong people love to use Chinese medicine, whether proprietary medicine or prescription. And particularly in this term of government, Sylvia and myself, we are very committed to promote development of Chinese medicine in Hong Kong. And that's why I announced for the first time in Hong Kong's history that Chinese medicine has been included into the public health system. Previously, they belonged to the private sector, but now they are part and parcel of the public health system. But of course, because of historical reasons and the predominance of the Western medicine, so it needs a long time to catch up. And this anti-epidemic fight has actually given us this opportunity to speed up the catching up, to get Hong Kong people more familiar with the Chinese medicine, the benefits and the use of Chinese medicine, and also to supply them with the Chinese medicine, whether through this proprietary pills, proprietary Chinese medicine tablets that we are providing in the packets, the bags, or through telemedicine provided by the Baptist University of Hong Kong, as well as the Alliance of the Chinese Medicine Practitioners in Hong Kong. But anybody who uses any medicine will have to consult. They will have to consult the doctor. They will have to read the warning notice on the prescribed medicine, including proprietary Chinese medicine. So for the 2 packets of proprietary Chinese medicine we put into the service bag, they are not for prevention. They are for curative purpose, especially at the early stage of the infection. So if you read the warning notices in the boxes, it's all very clear. So this wide use of Chinese medicine in Hong Kong has to be based on science, based on efficacy, and based on consumer education and understanding. And that's why the Chinese Academy of Science academician Tong Xiaoling, when he came to Hong Kong after visiting various places, he said that we are making good use, but we could improve in at least the three aspects: making it easier to understand, making it easier to be supplied with, and also making it easier for the standardization. So it's 易懂易行易得. So this has given us a very good direction to carry on with our work. Thank you.
好，跟住下一位記者提問。
Next question. To my right, in the middle, the gentleman. I'm from HK01. A few questions. The first question, the consumption voucher. Just then there is an announcement that the consumption voucher will be distributed on the 7th of April. But now we're still seeing thousands of infections every day. On the one hand, the government's asking people not to go tomb sweeping on the 5th of April, but now the consumption vouchers will be given out soon. Don't you see there's a contradiction there leading to more people out and about? Second question about the restrictions on gatherings. You said the group gathering restrictions will remain for a while, but then with more relaxations down the road, even when you have a soccer game, there may be easily 20 people, but then you still have this group gathering restriction on 2 people per gathering. So what's the scientific basis or other basis for your cap on gathering? Or is it just out of political consideration because you don't want to see demonstrations, etc.? Third question for about the chief executive election. The announcement is that from today to the election day, their indoor gatherings allowed for election purposes, but then inter-family gatherings are not allowed. Grandparents cannot visit their grandkids. There's also report that the day before yesterday, you had a discussion with the central government. That's why you cancelled the COVID press briefing on that day. Does it mean that the chief executive election trumps our anti-epidemic effort? Are you worried that this gives a false impression, a misleading impression to people that the CE election candidates can somehow not be bound by the social distancing rules? From March 9th to this moment, I've been holding COVID press briefings. It's on our anti-epidemic work, but I'm happy to take questions about topics other than the anti-COVID effort. But this is still a briefing on COVID. I'll try my best to take the questions not related to COVID, but I may not be in the best position to take some of the questions, including questions on the consumption voucher. After all, this is something that's proposed by the Financial Secretary. There's also a task force in the Financial Secretary's office in charge of this exercise. This is the first phase of the consumption voucher. And there's a long period of time in which people can use the first phase of the voucher. So this is not something people have to spend right away. After all, there's a window for people to spend the consumption voucher. Fighting COVID comes first. We're still asking people to avoid gatherings, avoid going out, avoid cross-family gatherings, and restaurants still cannot do evening dining sessions. These are the conditions that remain in place as the consumption voucher is rolled out and they're used. So there's no contradiction or something like that here. The second point about the gathering ban. Over the past 2 years or so, the gathering ban has been a tricky question. 2 years ago, I mentioned this cartoon where you have a tug-of-war involving 3 parties. Every time we announce measures that guard against imported cases and infections at home, public health comes first, but then we have to bear in mind the impact on the economy and public acceptance. There's no political consideration. It's just an act of balancing those three factors that I mentioned. The third point, it's also on this topic. It's about striking a balance again. The chief executive election is held every 5 years. The chief executive is the head of the Hong Kong government and the HKSAR. I believe people will want to see an open, fair, and honest election that's held smoothly. For an election, getting nominations is a necessary part of it. Equally necessary is a process to validate the nominations. After all, we now have the Candidate Eligibility Review Committee, or the CERC. After the CERC validates the nominations, the campaigning follows. I took part in this election. Back then, there were only 1,200 election committee members, but there were 2 other candidates, and we were facing the whole community. We had all sorts of activities. So in maintaining a balance, we considered different factors, protecting public health, and we also have to bear in mind the importance of this election. We need to let some of the activities related to the election to proceed. This is also the spirit of the Prevention and Control of Disease Ordinance. There are exemptions in laws. In certain conditions, exemptions can be granted, say for cross-boundary truck drivers, but they have to meet the socio-economic needs of our community. There are also people in work related to anti-epidemic work, so there are also exemptions that apply to them. Now, given major public interest is at stake here, the Chief Secretary for Administration made a decision yesterday, that is, exempting election-related activities, exempting such activities from the gathering bans on 2 people per gathering or cross-family gatherings. Thank you. Next question. To my left, at the front, gentleman. I'm from Phoenix TV. I have 3 questions. Yesterday, the anti-epidemic service bags were distributed smoothly. 1.3 such bags were distributed. Have you considered handing out something like bracelets a month ago or supplies packs a month ago? And if a compulsory universal test is launched, will you consider a similar distribution model? Second point, you have been trying to incorporate Chinese medicine into the public health system. Mr. Tong Xiaolin also mentioned yesterday that we should be incorporating Chinese medicine into the public healthcare system and for use not just in an emergency but also in normal times. Do you have any plan for such incorporation? The third point, in terms of using Chinese medicine to facilitate recuperation, there are people staying at the North Atlanta Hospital Infection Control Center. Others are staying at the Asia World Expo isolation facility. They're also holding centers. Does it mean that for the treatment involving Chinese medicine will not be applied in public hospitals? Another point I wish to raise here, for rehabilitation, there are only 18 designated clinics, but many people recovering from COVID, are those 18 clinics enough to cope with the need? I thank you for the 3 questions. Starting from yesterday, speakers start using a microphone. 3 questions. Starting from yesterday, we started distributing anti-epidemic service bags with the support of different sectors in the community. It went smoothly. We're trying to get the bags distributed in less than 7 days. But there is a need to plug gaps in this exercise, so we will have the service points or refilling points in the community so that those who didn't get a bag will be able to pick up a service bag at those places. You raised a question, why did we not mobilize the community to do something similar a month ago? We have always relied on community support for different measures, but in handing out the anti-epidemic service bags, we need the content, the supplies in the service bags before we can proceed with such an exercise. We only had everything we need only recently. We want to avoid a situation where halfway through the exercise we realize we have a shortage of materials. So we need everything in place before we can proceed or get things started. And for Chinese medicine, the earlier supplies have already been distributed, the 600,000 packs of Chinese medicine, and then we got more from the central authorities. The central authorities procured more and delivered them to us. And then some necessary preparation had to be made before the distribution exercise. So every time something major happens in Hong Kong, we want to have this kind of unity and solidarity in taking forward an exercise. So now we have an opportunity. On April 8th through 10th, over the 3-day period, we hope everyone in the city can do a daily test with the rapid antigen test. It's self-testing. It will be a simple step. We want to find out the level of infections in the community, just so we get a better picture about the infections in the community. It's not a perfectly scientific approach because some people will be doing the test, others may not. It's a voluntary exercise. This step alone will not help us achieve zero COVID right away because people are moving around. But this is a step, a kind of screening, a tool for us to get a picture of the situation. Because now that we have the supplies available, every household gets enough rapid antigen test kits. And that's now the self-testing becomes possible. And in the future, when the timing is right for a compulsory universal testing, we will also mobilize forces in the community because seniors may need help and they need someone to accompany them to a testing site. And some people may need to help the seniors make an appointment for the testing online. But we will mobilize them in handing out the service bags and universal testing. These two different exercises require different input. For any universal testing, we need people taking the specimens. And these people require training. Mobilizing people in the community alone may not be enough for us to get 9,000 trained workers taking specimens. This will require trained specialists. We also need workers in testing labs. Again, we need trained people to do the testing work. The community forces we can mobilize today may not be enough for a universal testing exercise. And the second point here, in terms of the development of TCM, we have made some breakthroughs in the current term administration. We have placed TCM in our public health system. In my policy address 3 years ago, I actually made this point. It certainly has its position in our system. But due to historical factors, some progress has to be made. And we have already get started with the construction of the first TCM hospital in Hong Kong. We never had one in the past. For Chinese medicine practitioners, we don't even have an arrangement where Chinese medicine practitioners can see patients inside the hospital. I'm aware that Mr. Tong Xiaolin said that he sees that in Hong Kong, in the development and application of Chinese medicine, we're still working within constraints, legal constraints. Say you have an equipment for testing, those may not be helpful for Chinese medicine practitioners. So there are institutional and policy constraints that need to be addressed. And I've asked the Food and Health Bureau to find ways to overcome these barriers. to facilitate the development of TCM in Hong Kong. Again, Mr. Tong Xiaolin also said that we need to help people understand when to use TCM. After all, Mr. Tong mentioned the 3 E's approach. And people may have only a limited understanding of TCM, or they may be told to use TCM when they're not feeling well, but that understanding may not be enough. So we have to make TCM easy to use. The third point here, standardization. Hong Kong has the conditions to achieve standardization in the practice of TCM. Right next to the Cheung Kwan O TCM hospital to be constructed, there will be something like a Chinese medicine testing center that meets the point raised by Mr. Tong Xiaolin that it has to be easy to implement. The final point, easy to access. We need to make it easy for people to access the TCM, the medicine and the services. We only have 18 Chinese medicine clinics. The number can be increased if there's a need. Now there is telemedicine services for TCM. People believe you have to see a Chinese medicine practitioner face to face for them to conduct a diagnosis. But now there are video conferencing, video options. You can take a picture, send over the picture to your Chinese medicine practitioner, and the practitioner can prescribe the medicine. The application of technology can facilitate the development of TCM. Now we have the Chinese medicine experts from the mainland. They're here not just for the treatment, but also to reduce severe illnesses, infections, and deaths. We also want to chart a new path for the development of TCM in our city. This needs to be a wide path. Prevention needs to be a part of it because the strength of TCM lies in preventive care. But there should also be treatment. It's not just about treating severe illnesses, but it also covers treating other illnesses. And it also has to do with rehabilitation. After all, facilitating recuperation is another strength of TCM. So there will be a comprehensive development of TCM in the days to come. And here's my appeal to the Western medicine community in Hong Kong. Have an open mind about the development of TCM because it will play a role in the community. I know Dr. Tony Cole supports the use of TCM, and I hope more Western medicine practitioners can also support this dual-track development featuring both Chinese and Western medicine in Hong Kong.
A lady at the back. TVB. Good morning, Mrs. Lam. About the anti-epidemic service pack, we have been following the team distributing the bags at the 3 new buildings. That they didn't seem to understand much about the subdivided units, that they leave behind a card. If there are 5 households there, would they be using the same card to get hold of the bags? And you're not sure how many households there are. Are there any means for them to prove their identity to get hold of the bags? That the nomination is starting today for the CE. Now you may prioritize anti-pandemic work, but can you share with us your thoughts? There is so much to do with regard to the CE election. What do you have in mind at this point in time? Is there any thoughts that you'd like to share with us? I'm sure people would be finding out whether Mrs. Lam would be seeking a second term in office, or you're going to take a rest. Right. First off, about the distribution of the anti-pandemic service pack, we're adopting a very liberal approach. No registration online is needed. No identification is needed. And we are using the outreach service, i.e. we're distributing the bags to the households. In the housing estates, the HD can do it. In the private sector, the property management officers can do the job. Now we also have the civil servants and volunteers on hand to distribute the bags. In the course of distribution, indeed, there were cases in which some of the people were not there. I visited about 18 households. 3 or 4 of them were not there. We leave behind a letter. But I can give you the undertaking that if anyone who says that they have received nothing, and we're going to have 90 replenishment centers that will be up and running. We will be adopting this liberal approach. Now, for the 2 households, I asked them how many. They said 5, and I give them an extra bag. We will not really check to make sure that the number is right. With the support of the central authorities, and we do have ample supply of the supplies. I think we have 200 million the RAT kits, and 3.5 million would use 70 million. So in these 90 replenishment centers, the SHA is telling me that to tie in with the daily RAT test on the 8th, 9th, and 10th, a lot of these RAT kits will be made available. People can just go and collect them. No question asked, and we would be very liberal with the supply. So this is not an issue at all. That during the visit by the volunteers, the local personalities, the councillors, they surely would know much better than we do about the people there. And as long as they need the supplies, there are no problem whatsoever. Indeed, today is the beginning of the nomination for the 6th term CE election. I'm going to give you the same reply. At the right time, I'll be announcing my personal intention, but at this point in time, it's not the right moment, so please bear with me. That's it for today's press briefing. I'll see you tomorrow. Thank you very much for coming.